Hi, good afternoon. Good afternoon. Hope you're having a nice day. Good morning. If you are somewhere, I don't know. I'm going to talk about some test-taking strategies. So whilst you are studying more, whilst you are practicing questions, whilst you are getting ready, you are preparing for this exam, there are some test-taking strategies that I just want to give it to you to have them behind your mind when you are practicing, when you are taking the test. Remember the test, the LPN has 205 questions. If they have not made any changes from the last test plan that they came up with since 2019, is 205. They did make a lot of changes during the COVID for both RN and the LPN. And then after the COVID, they went back to make changes as well, or we are still in the COVID mode, but some of the changes, they still went back to their normal. Others, they did not fix it. So depending on what it is, but this is the standard I'm giving you, LPN will have 205 questions for 5 hours. RN will have, right now, the last time I heard is 145 for 5 hours. But the minimum for you to pass this exam as an LPN is 85 questions. So when you start and the computer is able to determine your potential, by 85 questions, the computer will go off. That's computer adaptive test. It is supposed to be a computer adaptive test. So you don't need to be a computer expert to pass your Nclex. You just need to sit on the computer. The computer give you directions as to what to do. And remember, 25 questions does not count towards your pass mark. So out of the 85, when you start and you are doing good, the computer keep you in that pace. It keep you in the passing line. They keep throwing difficult questions for you. You're getting them correct. You don't need to get all 85 questions correct to pass, but your trend at which you get questions correct determines whether you will pass, especially the standard analysis and application level questions. You need to be able to tackle those things, how to respond, how to teach a patient, how to be able to figure out correct answers, which statement is correct, which statement by the patient needs further teaching, and what you will do as a nurse. You need to know your pharmacology or your test plan component. You need to have a clear understanding as a minimum competent nurse to pass it. So remember, it's not testing you as a well-experienced nurse, as a well-experienced LPN. The exam is testing you as a minimum, it's putting you at a minimum entry level nurse, period. You don't need to be an expert. If you have been on the floor, I keep saying it, if you have worked, if you have experience of how patients' disease conditions are being managed, please, for the Nclex, for the sake of the Nclex, a lot of things are going to be different. That's why it is best to go by the book. When you go by what you know, if you're already a patient, or if you're already a nurse in your country and you are going to take the Nclex, please, what you see being done, we have facility policies, facility protocols, and we have the Nclex standard. So try to study what the book is guiding you. It is okay to know the signs and symptoms patients present with their health problems, but it is not okay for you to jump answers on the Nclex. Don't answer like you already know. Don't answer like you are already a nurse on the floor. If you have happened to be a nurse in another country, don't go on the Nclex and then you allow your practice to affect how you answer questions. This is all I just want to tell you. And if you are a tech, if you are a nursing assistant right now, and you are taking the Nclex and you have been on the floor and you see how they tackle patient situations, please, 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 I beg you, for the sake of the Nclex, you cannot go by what you keep seeing on the floor, because it is the same, But remember, facility policies, facility protocols come in place to mix up with what they are doing. They are experienced people and they have the baseline understanding. You do not have. Go by what the book is telling you and what Nclex want. So let's talk about test-taking strategies. Test-taking strategies. My focus right now is what are the tips you need to be able to pick out correct answers. That's why I am guiding you to study your content, have the baseline information, which is the framework for the Nclex. The content is the framework, and you are building on it with critical thinking and computer adaptive testing ability to pass the exam. So this section that I'm going to talk about, the test-taking strategies will contain a list of strategies that I'm going to give it to you. And I think you'll find it helpful as you work your way through this test, okay? So by taking what you know and applying logical thought to it, you can maximize your chances of answering any question correctly. It is very important for you to realize that every question is different on the Nclex, and every person is different sitting in there. When you go for the exam, you see other people sitting there facing their computers. People are writing different forms of exams. Somebody's writing pharmaceutical exam. Somebody is writing registered nursing. Somebody is writing medical professional testing. Everybody sitting in there is writing different. So even if I went there with my friend and we all sat closer to each other, mind you, your test is different from the next person. You are not writing the same questions. Don't be deceived. You cannot share answers and you wouldn't even have that chance. And the computer has a camera that is monitoring all what you do. So no single strategy will work on every question. Remember that. So for the first question you answered, it's not the same strategy that will work for the question number 2. So take notice, okay? And no single strategy will work for every person as well. It's not one strategy that will work for every person. So get the facts from what I'm saying. Think through yourself, analyze your ability, how much information you have studied, how much you can critically judge questions and scenarios and figure the question answer out. So that's why I have included that you can try them out and determine which one. So all these strategies I am going to give you, you can try them and then you try to figure out which one is going to work for you. What will work for you is not going to work for me. So I know people are different. So figure out who you are first, how your studying ability is, your understanding, and then choose which one is going to work for you. So I'm going to talk about the questions, strategies, and the answer choice strategies for you. So the first thing I'm going to talk about, question strategies. We have number 1, read. I'm not giving notes on this. Please take a book, write them down, think through it. Repeat the video if you have to. Get a pen, get a book. You can pause it and let me know if you have any concern from this. So you want to read carefully. This is the question strategies I'm giving you. You want to read the questions carefully. Each question that is presented to you, read it carefully. Okay? So you read the question and the answer choice carefully. Don't miss the question because you misread the terms. Don't jump it. Just because you have seen a question that was similar to that particular question whilst you were doing your preparation, doesn't mean when you start reading the first part of the sentence and you see familiar words, you start jumping it. No, read it carefully. Don't misread the question and the answer choices. You have plenty of time to read each question though. You have enough time, okay? So you read it thoroughly and make sure you understand what is being asked for. That's the number 1 clue for you to be able to figure out what you're doing. Read it carefully, understand what they're asking you for, what they want you to do in that question. So yet we have a happy medium and this must be attained. So don't waste too much time as well. So the happy medium is the fact that you have a lot of time to answer these questions. You have enough time to understand the question, but don't also waste the time too much, okay? You must read it carefully and efficiently. I had told myself that if I am reading a question, unless it's a very long or voluminous question, I am going to go over the question slowly the first time, go the second time, go over the answer choices, and then I go back. And then I now repeat it to myself to see if I was the nurse in this situation and this happened, that happened, before I start thinking of answer choices. So you must read it carefully and efficiently. That's strategy number one, reading the question carefully. Strategy number two, contextual clues. Contextual clues that will hint you. You want to look for contextual clues. Okay, if the question includes a word you are not familiar with, look at the immediate context for some indications of what the word might mean. Look at the immediate context for some indications of what the word might mean. Contextual clues can often give you all the information you need to decide the meaning of an unfamiliar word. So when they put a word in the question that is not familiar, they will give you the context that will be behind the whole description will give you a clue as to what to look out for. That's the clue you are interested in. So just because they mention that disease condition, you don't understand it, doesn't mean all the other information is not enough to give you a hint. You understand? All the other information in that question, the context in it will be enough. So even if you can't determine the meaning of that particular word, you may be able to narrow down the possibilities enough to make a solid guess at the answer to the question. So the next thing I'm going to talk about is prefixes. The next strategy is prefixes. So if you are having trouble with a word in the question or the answer choices, you want to try dissecting it. You want to take advantage of every clue that the word might include. So prefixes and suffixes can be a huge help. Prefixes and suffixes, if you remember your English language, they can be a huge help. Usually, they allow you to determine a basic meaning. That's the pre-meaning before post means. After pre is always positive, okay? D is always negative. So from prefixes and suffixes, you can get an idea of the general meaning of the word, and you try to put it into a context of caring, a context of a hospital environment as the nurse. So you want to take notice of questions that are asking you of a negative attitude by the family or by the patient, something that is wrong, something that would describe the action that is being done. That's the prefixes. You also want to look for hedge words. We have words that will give you heads up. So you watch out for critical hedge words such as likely, may, can, sometimes, often, almost, mostly, usually, generally, rarely, and sometimes. These are words, okay? So question writers insert these hedge phrases to cover every possibility. You see these things mostly in the answer choices as well. So they cover the phrases to cover every possibility. So often an answer choice will be wrong simply because it leaves no room for exception. Okay, so for answer choices that have these words likely, may, can, sometimes, often, most, almost, always, mostly, usually, rarely, sometimes, and all those things, generally, that would just, most of them, they don't leave room for exceptions. So they will almost always be wrong, simply because they are not given options. So take notice. All right, so be on the guard. You have to watch out for answer choices that have definitive words, such as exactly and always. Exactly and always. take notice of those ones as well. Then let's look at switchback words. Switchback words. These ones, you have to stay alert for switchback words. They are the words and the phrases that are frequently used to alert you to shift in thoughts. They give you a hint for you to shift your thinking when you are answering questions. The most common switchback words are but. But. So they are giving you a phrase, they are giving you a sentence, they're telling you a patient problem, and they put but. They say although, and they say however. You understand? So others will include nevertheless, on the other hand, even though, while, in spite of, despite, and regardless of. So switchback words are important to catch because they can change the direction of the question or the answer choice. So take notice of these ones as well. The last one is the face value. The face value that I'm going to talk about. So when you are in doubt, you use common sense, okay? Common sense, that's it. You're doubting, you're not sure, use common sense. So you accept the situation in the problem at face value, just as you see it, accept the situation in the question. This is when you are not sure. Don't read too much into it, please. Don't go and read the question. They give you signs and symptoms of diabetic ketoacidosis, and then you jump straight to different types of diabetes. Don't go look for that. If they just want, if the patient describes signs and symptoms of diabetes and they want you to do management, look for the most recent one or the most easiest step that will not, that will help save life and not ignore the patient problem right now. You want to figure out, okay? So use common sense. So these problems will not require you to make, don't read too much into the question. This is the number one thing students do. They read too much into the question for one or two reasons. They have studied too much. And for some people, they think have had enough content. So if a patient has diabetic, the patient has never been diagnosed, you have no choice jumping straight to diabetes ketoacidosis. The patient has not done testing yet. You haven't seen the value for the glucose level. How do you say it's diabetic ketoacidosis? So for a patient that just come present to you and they want you to answer questions under this, don't jump picking up answers because diabetic ketoacidosis, you haven't seen the finger stick yet. So if the glucose level is 250, you understand diabetic ketoacidosis, it's usually above 300 to 800 or so. So you have to be careful. Don't read too much and don't know too much. Don't know too much. We have people that know too much and they are finding it difficult to pass it. The exam is not for smart brains. It's not for people who are intelligent. It's not for people who are stupid. It's for people who understand strategies to apply their knowledge from the book. Strategies to apply their knowledge in caring for patients. Strategies to be a safe nurse, and strategies to go with computer adaptive testing skill. How the computer throw the questions at you, you are strong enough to face it. Difficult question, I get it correct. I figure out. I understand the question, I read it while I analyze it. So these problems will not require you to make wild assumptions. So for those that you don't know what it is, it's not for you to go making wild assumptions. Don't assume into the question. So they give you signs and symptoms, that is what they are presenting. Don't go bring in any information from that particular disease condition and add. So just because you have been faced with something you are not sure with, you are doubting it, you go looking for signs and symptoms for that particular problem. Don't change the question in your mind. Go by what the question is asking you. So if you have to go beyond creativity and wrap time or space in order to have an answer choice fit the question, then you should move on and consider the other answer choices. So read all the answer choices if you're not sure about the word you saw in the distance. But remember, I had mentioned that they will always give you clues clues to be able to figure out in the answer choices. So these are normal problems that are rooted in realities. These are, like I said, I keep telling you, the Nclex is not a fixation. It's not an act. It's not a creative exam. It's reality. Real scenarios they present to you in a computer form. So take it as you interacting with a patient who has a problem. So the applicable relationship or explanation may not be readily apparent, but it is there for you to figure out. They will have enough for you to be able to figure out. So use common sense to interpret anything that isn't clear. Once you interpret, use common sense. If it's not clear, use common sense to interpret it. Let's look at the answer choices strategies that you should use on this exam. So the first thing I want to talk about is answer selection, selecting your answers. So the most thorough way to pick an answer choice is to identify and eliminate wrong answers until only one is left. Usually you have two left. You'll be able to identify the first two wrong answers right away. But the last two, look for clues in between the two to be able to identify which one is the safest. Okay, so you want to confirm if it is correct. Don't just pick it and go. Sometimes an answer choice may immediately seem right, but be careful. That's what I'm saying. So the last two that you'll be narrowed down to, look at them critically. One will seem to you very correct. The other one will seem to have a word or two that make you doubt it. But don't just go straight to the one that seems to you straightforward, it is correct. It may not be, it's not always the case, okay? So the test writers will usually put more than one reasonable answer choices on each question, okay? So they intentionally put more than one reasonable answer choice for you to pick. So the answer choices, you'll be down to two. You'll be able to figure out two are already out of this context. But I'm left with two. Now, look at those two. Don't just pick the one that seemed correct to you. Assess it well. Assess between and judge between the two well with critical thinking skills. So take a second to read all of them and make sure that the one choice are not equally obvious. The one that you seem correct and all the two choices that are left are not equally obvious. So as long as you have time left, it is better to read every answer choice than to pick the first one that looks right without checking the other answers. Your behavior on the test also determines how you pass or whether you pass or fail. Sometimes behavior will fail you. So you start reading the question, you're already pissed off because you know that the past two questions I answered are wrong. You just start choosing. You're upset already. Your mind starts going crazy. How about if I fail? You start judging yourself before you answer all the questions or before the computer goes off. You're panicking because you don't know when the computer is going to go off. Relax. Relax, okay? If you cannot relax, it's going to be hard to pass this exam. The next one is answer choice families. Answer choice families. So an answer choice family consists of two. In rare cases, three of them. That's the one I just spoke about. So answer choices that are very similar in construction and cannot all be true at the same time. They'll be similar in construction, but you know that unless it's select all that apply, even select all that apply will not demand all of them to be similar. They will always demand all of them to be correct actions you will take. Okay, so the last two will be similar, but they all cannot be correct. They need one answer. So if you see two answer choices that are direct, opposite, or parallels, or parallel ones, one of them is usually the correct answer. Direct opposite or parallel to the other is usually the correct answer. So for instance, if one answer choice says quantity times increases, quantity X increases, and another either says the quantity X will decreases, that's opposites, right? So one will say quantity X will increase, and the other one will say quantity X will decrease. That's opposite. They are both correct answers, but they look opposite. Or it says quantity Y will increase. So these are three. One is X will decrease. One is X will increase. That's opposition. Another one is Y will increase. These are three answer choices that are similar, but they're talking about increase and decrease, especially when it comes to some positioning. They want to know, will you position the patient on the left side, semi-fowlers left side, semi-fowlers right side, high fowlers on the back, supine, and this and that and that. You always get confused. But with those kind of questions, look at where the problem is coming from. If I position the patient on the left, will it help relieve pressure? Will this help? Take notice of those kind of answers. Then those answer choices will fall into same family. That's what I just finished explaining. An answer choice that doesn't match the construction of the answer choice family is more likely to be incorrect. So if one doesn't match the answer choice group that you are tackling the problem, ignore that. So most questions will not have answer choice families, but when they do appear, you should be prepared to recognize them. If it is not consistent with the question, you have to be prepared to eliminate them. Now let's talk about eliminating answers. How do you eliminate? So you eliminate the answer choices as soon as you realize they are wrong. First two questions are always wrong. I'm not saying the A and B, but when you read the answer options, you will always be able to figure out two wrong ones straightforward if you have studied enough. But make sure you consider all possibilities. Don't ignore them just because you have clearly seen that. Consider all possibilities in comparing all the answer options and what the question says. Remember, we spoke about the question strategies. When you tackle the question strategy well, you come and tackle the answering strategies well. So if you are eliminating answer choices and realize that the last one you are left with is also wrong, don't panic. Don't panic, okay? You have to start all over again and consider each answer choice again. Don't panic. There may be something you missed the first time that you will realize on the second pass and the second time you are reading through. So be careful. Avoid fact traps. Avoid facts and traps. Traps, you know a trap, right? Things that catch your attention, that will attract you. Don't be distracted by an answer choice that is factually true. Factually true, okay? But that it doesn't answer the question too. It's a fact. But does it actually address this question I have? No. So don't be trapped. It will look sweet. It will look easy to do. Patient coming with chest pain, order an EKG or call the tech to come and do EKG. Have you assessed your patient? No. It's a fact that you have seen that EKG was the first thing your facility, the nurse you were working with did. Or the doctor said, oh, the patient has chest pain. And then the patient walked up to you and the doctor said, oh, get an EKG. The facility said EKG should be done 5 minutes. Then you go choose that answer, get an EKG. It's a fact. You will get an EKG. That's true. It's not a lie. But you are a nurse. I came to you, I said, my chest hurts. Are there other things you can figure out from me? Did you gather more information? Are you supposed to put an order when you're supposed to carry out orders? Facility difference, okay? If you have seen it, then facility policy, facility protocol. You are a student. You are a nurse. You are an LPN. Don't jump steps. Don't pick answer options because they look like the fact to you. Take your time, okay? So when you keep jumping facts, you'll be missing answers. You are looking for the choice that answers the question. So you have to stay focused. Stay focused on what the question is asking for. Okay? So you don't accidentally pick the answer that is true but incorrect for this scenario. So some people, their problem is that they're asking for a negative statement from the patient. Which of this would demand follow-up? Which of this will you stop the nursing assistant and re-educate? Then you go pick the correct, the one that is a right action the person is taking. It is correct. That is the right thing the person is doing, but the person wants a negative answer, something that is wrong. So you have to be able to understand, to pick up correct. Always go back to the question and make sure that the answer choices you have selected actually answers the question and is not merely a true statement. You're not just looking for a true statement. You have to be careful with these exams. This is why most people miss out on a lot of important things. So the next one is extreme statement. Extreme statement. Sometimes they put up a lot of statement for you to get confused. So in general, you should avoid answers that put forth extreme actions as standard practice or proclaim controversial ideas as established fact. An answer choice that states the process should be used in certain situations if it's much more likely to be correct than one that states the process should be discontinued completely. Okay. Let me repeat that again. An answer choice that states the process should be used in certain situations if it's much more likely to be correct, okay, than the one that will state process should be discontinued completely and never come back to it completely. So the one that gives a room for it to be a possibility in case of a need make more sense because you don't know if the patient is going to get a rebound in the care you are providing, so you cannot stop it completely. Okay. So the first is a calm rationale. Rationale that don't be harsh. Don't pick answers that show that you are harsh. You don't want to be a harshness. So a calm rationale and statement, and it doesn't even make definitive, uncompromising stance. Using a hedge words if it is to provide wiggle room, whereas the second choice is far more extreme. So we have extreme statement that will just go like, okay, I will always, no, why will you always be flexible, easy? Let's look at the next one is benchmark. Benchmark. So as you read through the answer choices, you come across one that seems to answer the question well. Mentally select that answer choice. This is not your final answer, but in your mind, you can put it in your mind. This is likely going to be it. But it's the one that will help you evaluate the answer, the other answer options. It will help you evaluate it. So the one that you selected is your benchmark, or you have a paper on that day. You have a little paper on that day that you'll be writing. So they give you the scratch paper to use and a pencil. So you are like picking the answers, you're reading 1, 2, and you go, okay, question, answer 2. You put it down, 2, and then you keep reading. You still continue to go over it, but you have to benchmark it. So that choice is, every other answer choice must be compared to your benchmark one, to the one that you have marked. So that choice is correct until proven otherwise by another answer option that you see beating it, another answer option that is more answering the question than the one you have benchmarked. So if you find a better answer, then that one becomes your new benchmark answer. So once you have decided that no other answer choice in the question answers the question as well as your benchmark, you have your final answer. So once you have decided that this one best address the problem, you are fine. Predict answers. Predict the answer. Let's talk about predicting the answer. So before you even start looking at the answer options, it is often best to try to predict the answer from the context of the question. That is why I take so much delight in having you learn the content, because when you have the content and you start reading the question, your mind would have already started directing you as to what to look out for in this particular disease problem. So they start talking about burns, you already have an idea about burns, the body percentages in adult, you have an idea about the acute phase, which IV fluid will be replaced, and what is the complication of burns and all those things. You already know their diet. They will need high protein. Okay, so when you already have the information from the question, the answer options, you're just looking for what will fit it. So, so even if you are confident that you have the right answer, you should take the time to read each answer or option before you move on. So on this note, let's move to general strategies. General strategies. So I spoke about answering question strategy, answer strategy. Now, general strategy, we have tough questions. That's the first strategy, tough questions. So if you are stamped in a problem or on a problem, or it appears too hard or too difficult, don't waste too much time, especially those that you just don't have a clear understanding. Don't waste too much time. You have to move on, okay? Remember though, if you can quickly check for obviously incorrect answer options, your chance of guessing correctly are greatly improved. So before you completely give up, at least try to knock out a couple of possible answers. Try to knock off a couple of possible answers. Eliminate what you can, and then guess at the remaining answer options before you move on. Okay? They tell you, the computer, you can go and come back, you can go and come back. But if you're not careful and you keep going and jumping a lot of questions and you're thinking that you're going to come back, you don't know when that computer is going to stop. So just be careful. Jump on questions, and when it's tough, try to understand the context, eliminate some few, and the last two you are left, you try to guess between them. So check your work as well. Check your work as well. So since you will probably not know every term that is listed and the answer to every question, it is important that you get credit for ones that you do know. Make sure for those that you know, don't miss the answers. Don't get them wrong for no reason. You can't give chances. So don't miss any question through careless mistakes. By jumping up the steps, you have seen this familiar question in your practice 2 years ago, or in your school 1 year ago. So the moment you start reading the question, you're already sure of where the answer is going to be. The answer was D. I remember when I was studying, the answer for this question was D. Listen, who told you it's the same question? Who told you the same scenario cannot be changed? Who told you there's no one word inside that has not changed? You have to take your time. Don't rush because you have seen it. That's the old maid syndrome. You are so used to the fact that you have been answering too many questions, and now every question you see looks familiar on the exam. No, it's different. Okay, don't be deceived. I'm telling you a fact. People have done it and they have failed and failed, frustrated, but you can do it. Don't frustrate yourself. Easy. So you have to check your work, okay? You have to check your work, you have to mark them, and then you want to double check the answers and pay attention to the ones that correctly fit the scenario. Now pace yourself. You want to give yourself some time. So it's easy to be overwhelmed when you are looking at a page full of questions, okay? So your mind is confused and full of random thoughts, and the clock is clicking or ticking down faster than you would like. Calm down and maintain the pace that you have set for yourself, especially as you get down to the last few minutes of your test. When you are looking at the clock and it's getting like 30 minutes to end, 30 minutes to be 5 hours, and then you start rushing. Don't let the small numbers on the clock make you panic, okay? So as long as you are on track by monitoring your pace, you are guaranteed to have time for each question. You know, the computer can cut you off at any time and it's either pass or fail. So if you make sure that the questions that you were very sure about, you knocked them off rightly, you should be good when the computer go off. But when you had an attitude, just upset, freaking your mind already, failing yourself in your mind, and you were not reading the questions well, you are not analyzing the answer options well, you know the content so much, but you didn't put it into good use, then I cannot tell you what happened. Don't rush, okay? That's the next thing. After pacing yourself in reading and picking up the choices, you don't have to rush. It is easy to make errors when you are in a hurry. Even in normal life, it is easy. So maintaining a fast pace in answering questions is pointless if it makes you miss answer options, or if it makes you miss the questions. Okay. If you make you miss questions that you would have gotten right otherwise. So rushing through and not making meaning out of it is useless. Somebody will tell you, oh, I used 30 minutes to finish 75 questions. Well, that is the person, and I passed. So when you sit there and you are getting to 2 hours and you are not able to figure out the answer options, you start freaking out your mind. Listen, I learned not to let people's pressure affect how I answer questions. So if somebody is able to use 30 minutes to finish 75 questions, that's the pace the person can go. Your pace is to be able to answer them correctly. And your pace is how much you understand that the time is 5 hours. I don't have to use 30 minutes to get 75. 30 minutes, I know I can only go like maybe 30 questions, 1 minute per question. It is fine. Nobody's pushing you. Don't go rush like Mr. A said, I just used 45 minutes and I got 85 and I passed. So you go there, your mind too is to use 35 minutes. Please, who told you both of you can analyze the questions the same? We are two different people. I always tell people, when you try to compare me to yourself, let's look at our palms. Let's look at our fingers. Let's look at our fingernails. Let's look at our faces. Do we look the same? Even if we are identical twins, what I have appetite for, do you have the same appetite right now? No, no two people are the same. Don't compare. If your friend went in and 20 minutes, they passed it and came out, don't do the same thing. I know myself. I will take my time and I use 1 hour for 75 questions, but I am analyzing them well. I was picking them correctly. So I get up and go. Okay? So don't rush yourself. If you are the slow answering type, and you understand what you're doing, be slow and sure. That's me. I am a slow but sure person. So you look at me, I appear slow, but I know exactly what I'm going to achieve. So don't go rushing yourself. So taking a little extra time to avoid careless mistakes can make all the difference in your test score, okay? So find a place that allows you to be confident in the answers that you select. Now, the last part of this is for you to keep moving. So panicking will not help you pass the test. I have repeated that on over. I cannot emphasize that enough. So do your best to stay calm and keep moving. Taking deep breaths, okay? And going through the answer, eliminating steps you practice, and that can help to break through stress barriers, okay? And keep your pace. You know, you can also go to the bathroom and come, right? But remember, when you go, the computer will still be moving. If you have to pee, you have to pee, okay? So just don't go to the bathroom and start crying. Don't go there and start, because you are going to the bathroom. Remember, you are still on camera. They have cameras in the building. So you are going to the bathroom and you don't have anything on you. You can just go and pee and come back. Before you go back and sit down, they'll still search you. Okay, so for a final note on these test-taking strategies, combination of a solid foundation of the content knowledge that I keep telling you about, and your confidence that comes from practicing your plan for applying that knowledge is the key to maximizing your performance on the test day. Okay. Remember, I will talk and I will not eliminate the content because it's a core foundation, it's a framework, it's a theoretical framework for the Nclex. So as your foundation of content knowledge is built up and strengthened, you will find that the strategies included in this particular presentation, okay, will become more effective in helping you quickly shift through the distracting or the traps that will help you isolate the correct answers from the incorrect ones. So now that you are prepared, you are preparing to move forward, your test content, your information is necessary. Use these strategies, read the questions carefully, make your critical judgment, don't rush yourself, benchmark your answer options. When you are narrowed down to situations that you just cannot understand, you can predict out of the best narrowed ones. When you have a question with words in it that are tough, you don't understand, they will always have clues in there to hint you as to what to look out for. So don't go sit on that exams if you want to go and all you are thinking is that I must pass at all costs, when you don't even understand computer adaptive testing strategies. So this is the end of this presentation. I told you I'm not giving you notes. You can make a note for yourself from this. I spoke about the answer strategies, question strategies, and I spoke about general strategies. Please put them together. Study the content, critically understand them, and pick up correct answers. I don't want you to go back, to go and write this test and come and go back again. This is your final stop. This is the last time you should be going for that exam if you have not gone. And if this is your first time, this should be the first time, and this should be a passing time. There is no room to go and come back. Okay, so I do wish you luck in your studies. I know you will continue to do what is right and you are going to pass it. Okay, so let me know if you need further coaching, further help. You're always welcome, and have a blessed day. Bye-bye.